Hi, good afternoon. Today we're going to go over Chapter 9, which is healthcare. I'm not going to go over everything. I'm going to go over some of the basic overriding concepts of healthcare, similar to what I've done on other chapters. Not going to get into all the detail and stuff. For that, you still have to read this chapter. First off, there's a couple different kinds of healthcare, right? There's private healthcare plans, and in a private healthcare plan, there are two different ones. So we're not talking about Medicare, Medicaid that's government provided and paid for by the federal or state government. We're looking at private healthcare plans. So a couple different policies that you can have. One, you can have an individual policy. An individual policy is when one single person or family writes a contract with an insurance provider. So it's kind of like buying your auto insurance. Those plans are very expensive. Healthcare can easily be $1,500 a month. For some of the even smallest plans with very limited coverage, you'll end up at $100 or $200 a month. Part of the reason that they are so expensive is most individuals who are in good health decide, I'm not going to buy healthcare. Typically, the only people buying individual plans are individuals who believe they're going to need a significant amount of medical services in the next year or year and a half, or they're even being paid by a third party. Maybe they've left their employer and their employer's picking up a year or 18 months worth of health care as part of a severance package. So dollar amounts don't really matter or come into play that much. Most plans are going to be group policies that are sold to an employer. So these are going to be that the employer provided health care. You then pick from 3 or 4 options that the employer has. The employer might have a low deductible plan that also has 0 copays, and you're going to pay $200, $300 a month for that. And the employer is going to pick up maybe $1,000 or $1,200 a month. If you have a really good healthcare plan with a lot of coverage, a lot of medication coverage, good access to physical therapy and stuff like that, these plans will run $2,000 a month. In fact, some of the estimates here within a few years for our college is that the costs are going to be probably well over $2,000 a month for individual family policies. So these are really expensive. The group policies, they're sold by the employer. You may have only one option. In other words, here it is, and you have to pay X amount of dollars. Maybe you pay a small amount a month or a lot a month, depends on what your employer wants to provide. Or you might have lots of options. There might be like some of the large employers. I worked for Ford for a while, obviously a massive employer, and we had 15, 20 different options that were available to us. I've worked at some employers in which they just provided one, and a lot of employers provide 2. And so you get the choice between an HMO, and we'll cover what that is in a little bit, or a PPO, and you only get those 2 options. Okay, so what are some of the private health care plans? Most of them are managed care or health maintenance organizations. And the idea behind a health maintenance organization is it's a prepaid health plan. You pay one fee, and then you're pretty much covered for anything. Maybe there's a $5 doctor visit or $10 doctor visit. There's $5 copays or $10 copays for medication. But other than that, everything is covered, right? And the insurance carrier is going to have contracts with selected care providers. So they're going to go out, they're going to write contracts with these 5, 6, 10 different doctors, and you have to go to those doctors. If you do not go to those doctors, they do not pay. Part of health maintenance is they want to be focused more on prevention and wellness, and it's a basic service. HMOs are much less expensive than the other one we'll get to in a little bit. It's called a PPO. Now, health maintenance organizations, which I love, some people really dislike their health maintenance organizations, and we'll get to why in a little bit. But a health maintenance organization is designed to give you good or adequate health care at a good price. You're not going to get Cadillac coverage. You're not going to get to be able to, whatever area you're in, go see the best orthopedic surgeon, the best ankle surgeon, the best hand surgeon, the best physical therapy place. It's not what it's designed for. So to give kind of an analogous, you get into a health maintenance organization because the price is really good. It's kind of like buying a Ford Focus, all right? A Ford Focus is a great car. I like those cars. In fact, I'm probably going to buy one for one of my kids. But it's a car designed to go from point A to point B with air conditioning, a good crash rating, and all that. But it is not a Ferrari. And you can't go into a health maintenance organization, pay a very low price, and buy, quote-unquote, a Ford Focus, and then turn around and expect a Ferrari type of service and performance. It just isn't there. A PPO is what's called a preferred provider organization. So typically there's several more providers to choose from. Certainly costs more than an HMO, maybe 50% more. You have a lot more choices, a lot fewer restrictions as far as who you can see, what your options are, the number of different medications that are covered. And we've also got point of service contracts, which are kind of a hybrid, which some organizations allow, which tries to take the best features of an HMO and the best features of a PPO. So what I'm going to do is kind of just draw a little bit of an illustration of the difference between an HMO and a PPO. Okay, so now I'm going to draw basically a very simple diagram of the difference between an HMO and a PPO. So first we're going to start with an HMO. So we have you as the individual who needs health care. And you are going to be assigned to a doctor, and that doctor gets what's called a capitalization rate. Basically, they're going to get $5 or $8 per month to have you on their service, whether you come 10 times a month or 0 times a month. They're also going to get additional money depending on what services that they provide in-house versus sending you somewhere else. So this doctor, you're assigned to one specific doctor. This doctor in an HMO is considered the gatekeeper. The way HMOs keep costs down is basically they limit your options. You have to go to this doctor, and him or her decides whether you need more medical services. And so you're going to go talk to this doctor. Maybe you've got an elbow injury or something like that. Typically, if it's not life-threatening, right, HMOs, PPOs, individual type 1s, pretty much all work the same. The United States has fantastic emergency type of coverage. I mean, really the best in the world. If someone without insurance gets in a major car accident, that person is going to the hospital, getting MRIs, getting taken care of, to make sure to save their life. So HMO, PPOs all work the same under life-threatening heart attacks type situations. But for the non-emergency things is where the HMOs try to save money. So typically you'll come to the doctor with an elbow injury. The doctor will send you back and say, hey, here's an anti-inflammatory. Take that for 2 months. If your elbow still hurts, come back. And so you take the medication. It doesn't work. You then come back and next time. The doctor typically says, well, here, let me give you a stronger medication for a couple months. And it still bothers you a little bit. But you go back again, back home. And the idea is that most injuries, including injuries of the heart, right, where your heart's been broken over somebody, time heals most wounds. And so this gatekeeper, instead of sending you to a specialist in which you're going to spend a lot of money on, and it's going to cost the insurance carrier a lot of money, they want to create a lot of time in here because they know probably 80% of all the elbow injuries are just going to heal over time, or ankle, or knee, or whatever that situation might be. Now, you've gone back and forth 2 or 3 times, and the doctor says, okay, we've done the medication, we've done this, now what we're going to do is send you to physical therapy. And so the doctor will give you a referral, and the HMO has negotiated with physical therapists who are going to give a very competitive price to the insurance carrier to get that business. And then they'll cut a contract with the doctor and HMO, so all the physical therapy comes from that place to this individual. Typically, you're going to get very adequate service here with physical therapy. They might get paid $20, $25 per visit. I mean, that might be as little as they get. They're going to then provide that service, and the doctor might give you, say, 5 to 10 visits. And after the 10th visit, you have to go back to your doctor to get reauthorized so that you can continue physical therapy if needed. And then that happens, and then you're back again needing an MRI because it's just not healing. Right? This is a non-life-threatening situation, and so the HMOs are designed to slow down this process, to slow down the delivery of health care, and in turn saves an awful lot of money because either you're going to get healed over time, or quite frankly, the injury doesn't hurt you that much. It's just a slight annoyance, and it's just not worth going through this process all the time. Now, if you need an MRI, you go back to the doctor, and the doctor has to authorize that. A lot of times in an HMO, this might be 6, 7, 8 months down the line. If there's other specialists you need to go to, maybe it's a cardiac surgeon or whatever other things going on, maybe a specialist with diabetes or whatever it is, all that has to go through your doctor, who is the gatekeeper, whose job is to do 2 things: give you adequate health care and hold down costs. And so this system is one of the least expensive out there, versus what is called a PPO. A PPO, the Preferred Provider Organization, does not have a gatekeeper. You still have an assigned primary physician who actually does get paid more money to see you than an HMO. In fact, a lot of times you can get in to see a doctor. That's a horrible looking smile, but what do you expect? You can get in to see your doctor usually a lot faster. Doctors are also a lot quicker to refer you out to somebody. So you can go over here to the physical therapist. So like when I hurt my elbow, I went to the doctor. The doctor gave me some anti-inflammatories, and at the exact same visit put me out to physical therapy. He didn't have to wait 60, 90 days to send me to physical therapy. I got sent right away, and I was given 30 visits, so about 3 months worth. So then I'm with the physical therapist. Halfway through this, it was clear that it wasn't getting better. So the physical therapist refers me back to my doctor. My doctor then sends me out for an MRI. I get the MRI done. They see what kind of damage is in there. Luckily, not a lot. And then after seeing the MRI, which took me 3 days to get into an MRI, by the way, I had the injection in my elbow. So later on, right, and then my elbow got better. Later on, I re-injured my elbow, and because the PPO does not have a gatekeeper, I just called the physical therapist directly, and I went straight to the physical therapist, and the physical therapist started to see me. If I've got a specific cardiac surgeon I want to go to, I can skip my doctor and go straight to a different specialist. Now, you're saying, wow, this PPO system sounds a heck of a lot better than the HMO system. Well, yes, it is, but you're going to pay probably 50 to 60% more. And a lot of times the employers don't want to pick up that additional money. So let's say an HMO costs $1,000 a month, and in the HMO, it might cost $1,000, of which you're expected to pay 20%, so your out-of-pocket might be $200 under the HMO system. The PPO system might cost near $2,000, probably around $1,600, $1,700, but just to keep the math easy, right? So this PPO might cost your employer $2,000 a month, and the employer might say, look, we're picking up $800 of this. We'll pick up maybe a couple extra $100, but we don't want to pick up all that money. So we'll pick up 80% of your HMO, so your employer pays $800, you pay $200, or a PPO where your employer says, hey, we'll pick up even more. We'll pick up $1,000, but we want you to pick up $1,000 also. When these things come up for vote and they talk about the services, almost always the employees vote for an HMO. Because for most people, under almost all circumstances, HMOs work just fine. So, what I also think, one other thing I'm going to add in, a lot of people think that, hey, we're in this health maintenance organization, we're in this PPO, I should never have to pay any money out of pocket. And I think if you need expert care or you want an expert second opinion, one of the best in the region or best in the state or best in the Western United States, then in my opinion, you know what? Reach into your pocket, pull out some money, and go pay for the second opinion. So what I think actually works best is to have an HMO. And then you've got to go through your doctor for everything. 90% of the time, 95% of the time, they're going to refer you out to people who are adequate. And I am specifically using that term, adequate. Because if you look at doctors, half of all the doctors have to be lower than average, and half of all the doctors are above average. And so there certainly are an awful lot of adequate doctors and specialists who are in the bottom third of all doctors and specialists. Unless you talk to teachers. 90% of teachers think they're in the top 10% of all teachers. But that can't be, right? 10% of the teachers are in the top 10%, 30% of teachers are in the bottom 30, so within everything you're going to have good and bad. So what I've done, and I've done it several times, one time my wife was really sick, and she had an inner ear nerve disorder. And so what we did is we were at the time in an HMO. We went to the doctor, we went to the specialists, and we just decided we didn't think this person was expert enough. So we went ahead and went out of pocket and went to the house ear clinic. The house ear clinic is considered one of the best ear clinics in the world. They designed the cochlear implant. And so we just went straight to this other expert and paid this person out of pocket $1,000 to see him so that we could get what we thought was probably one of the best doctors for that specific area in the United States. And we lucked out they happened to be in our backyard. But instead of paying $1,000 a month for the PPO, right, we're paying $200 a month here, which means I'm saving a lot of money, or whatever that difference is. I can probably go out of pocket 3 or 4 times. We also did this for my daughter. We went to a pediatric sinus surgeon. We didn't like the person we were with, and we ended up with the person who was pretty much renowned as one of the top 5 pediatric surgeons for sinuses in the United States. And we paid $800 for 20 minutes of that individual's time. And it paid for itself by far. And there's other times we've gone out of pocket. Because if you're looking to limit costs, and right now healthcare is 16% of all income in the United States is sucked up with healthcare. It's predicted it could be up to 33%. And so we need some way to limit costs. If you're willing to spend $1,000 on an expert, odds are you really need that opinion, or you really think you need that opinion. If I could go to the world-renowned expert for nothing, then everybody's going to want to go to this person, and there's going to be no way to get in, and costs are going to skyrocket. Similar with, if let's say this is an HMO, I go to my doctor here within the HMO because my son got hit in the head with a baseball during Little League. We cannot give an MRI to every single kid in the United States who gets hit in the head with a baseball. If we did that, we'd go broke. We do know that by not giving MRIs to those kids, that one or two or a half a dozen kids are going to get missed, having a subdermal hematoma, basically bleeding in the brain, and they're going to die. But you just cannot give an MRI to every kid. More likely than not, if you did that with every kid, more kids would end up getting cancer long term than you're going to save by giving the MRI and finding a hidden bleed in the brain. So the doctor turns it down, and if you look at your kid and decide that your child or your spouse is acting funny, that you really think there's a problem, then you know what? Go down to the doctor, get out your checkbook, get out your credit card, and pay $800 or $900 for an MRI. It's worth it to at least put your mind at ease. One of our family members, kind of extended family member, was really upset that they've been paying insurance and they couldn't get to what was one of the best cancer clinics in the nation that's local. The HMO turned them down and said, we don't have a contract with them. And so this kind of extended family member was upset, and they were talking about it. And I remember going to that family member and saying, you know, your house is paid for, you've got plenty of money, maybe it's going to cost you $2,000 to go see the doctor 2 or 3 times and get some tests done. You know what? Pay the $2,000 or $3,000. I mean, if you want to go to the world's best cancer clinic for that specific cancer, then reach into your pocket and pay the money. Long run, it will totally be worth it. The other thing, working within the HMO, when we went to the house ear clinic, they ended up giving a whole bunch of tests that they wanted run. And so we took this list of tests and the rationale, and it was going to be very expensive to run all these tests at the house ear clinic, we took them back to the ear, nose, and throat guy who was assigned to us, who looked at that list, and we said, hey, we went to the house ear clinic, one of the world-renowned locations. We talked to this doctor. Here's the tests they want, and here's the rationale behind that testing. And this doctor looked at that and said, oh, okay, well, obviously one of the world-renowned doctors in this area says you should do the testing. So they went and did all this testing at the HMO. So I got all that approved because there was a rationale behind it. We then took all the results and went back to the doctor for another visit and got a very good tailored medical treatment that we wanted, and it was worth by far the $2,000. So in my opinion, the best way to go for healthcare, get in an HMO. It solves 95% of all your problems, if not more, at a very reasonable price. And when you have a really unique type of problem, go outside the system, find who the best doctor is in that area. One of the things you could do to find who's best in that area is find out, like the NFL sports teams and baseball teams, what doctors do they use? If you need rotator cuff surgery, Find the doctor who's doing rotator cuff surgery for the professional baseball team in your area, and you'll probably have a great doctor. Or is doing that person's knees or ankles or something else. All right. Well, there's also an awful lot more detail here that we could go through in the healthcare system. But we're going to leave it at that now. And make sure you read this chapter because there's a lot of nuances in the different types of systems. All right. Thank you very much. And that's the end of this chapter.